neovascular AMD is a chronic disease. Once the production of vascular endothelial growth factor, VEGF, starts, it tends to continue. And our current treatments are such that we inject an antibody or a protein that binds the VEGF, reduces it, and that reduces the leakage and allows improvement of vision or maintenance of vision. But, after about a month, that protein has exited from the eye, and then the VEGF levels go back up, and so the leakage occurs, the vision goes down, and then another injection is needed. And so most patients with neovascular AMD require injections every 4 to 6 weeks. And that goes on for years and years, essentially for the rest of their life. So it's very difficult. And what happens is that, things happen, life gets in the way, you get sick, family issues occur. You're not able to come in for the visits and get the injections as regularly as needed. And so many patients tend to lose vision over time. So, having treatments that have greater sustainability, such as RGX-314, where you do a subretinal injection, and then the gene that makes the therapeutic protein goes into the cells in the eye, and then that anti-VEGF protein is constantly being produced in the eye. And that suppresses the leakage and keeps it down long term. And so as a result, patients don't require the injections that they were requiring frequently prior to the gene therapy. And that can, not only ease the burden, but it can provide better outcomes because there's not the lapses in treatment that tend to occur with the standard course of treatment. Yeah, you're right. The tolerability, the safety is very important because with any gene therapy and a procedure that requires you go into the operating room, that safety is really key. And there was good safety and tolerability. Another important thing was in this trial, the production of the anti-VEGF protein was measured. And so in the first 2 cohorts at the lower dose, there was very little production of therapeutic protein, and there was little effect. Those patients did not get benefit, and they continued to require anti-VEGF injections. But in cohorts 3 through 5, when the dose was increased, the production of the anti-VEGF protein went up, and it stayed up for the 2 years of the trial. And, this is very important because it helps us interpret the results. We know now why the beneficial effects were not there in the first 2 cohorts, but in the cohorts 3 through 5, with production of the anti-VEGF protein, many of the patients had control of the fluid production and maintenance of vision. Yeah, these results really helped to design the pivotal trials because we found that at doses in the mid-range, there was quite good benefit and really good safety. When we got up to the highest dose, there was quite good benefit, but also some patients experienced some changes. One patient had pigmentary changes that occurred in the macula, causing some reduction in vision. So we know now the range of doses which provide the greatest benefit to risk ratio. And that's what's being used in the pivotal trials. So there are 2 ongoing phase 3 trials. One is ahead of the other. Enrollment in that first trial should be completed later this year, and then the results are assessed for a year after the last patient is enrolled. And then those results will be ready. The second phase 3 trial is, perhaps 8 months to a year behind that. And so, that's going to be the one that determines exactly when the data from the 2 independent trials will be ready to submit to the FDA. Once those data are submitted, the FDA often deliberates for in the range of 6 months to 12 months before determining whether the agent should be approved. Well, we've been very fortunate in ophthalmology because, some conditions that previously were really devastating, like neovascular AMD, are now treatable. And we've had, since the development of the first anti-VEGFs, we've had multiple others that have provided incremental improvement because they might last a little bit longer. There's also, a bispecific antibody that attacks 2 targets that might provide a little bit of additional benefit. But thus far, the benefits have been really incremental since that first big step. With the development of long-term sustained treatment, I think the benefits are going to be substantially greater. And so there's not only the gene therapy approach, but various sustained delivery approaches that allow slow release of anti-VEGF and other agents into the vitreous that then can reduce the need for really frequent visits and injections and yet maintain vision in these patients. And that's going to be really exciting. Well, I think, as you pointed out, there's other gene therapy approaches that are being tested. And so hearing the early results on some of those will be good. And also the other sustained delivery approaches, seeing the results from early phase trials of the various platforms that provide sustained delivery, I think will be very interesting.